Welcome to the deep dive. I'm here today, and we're going to unpack a really significant policy shift, Executive Order 14155.
That's the one concerning the withdrawal of the United States from the World Health Organization, the WHO.
Exactly. And I'm here to explore what this decision means kind of on the ground.
And for this deep dive, we've gathered quite a bit of material. We're looking at the Wikipedia page for the order itself, the full text, which we found on Wikisource, and also its official publication in the Federal Register.
Right, so our mission really is to understand the details, the specifics of this order.
Yeah, and the context around it, what led up to it.
And, importantly, the initial reactions it sparked. How did people respond right away?
Okay, so let's get right into it then. Executive Order 44155. It was signed on January 20th, 2025.
Now, what makes that date particularly noteworthy here?
Well, that was Inauguration Day, the very first day of President Trump's second term.
Wow. So making a decision like this on day one, that's a powerful signal.
It really is.
Yeah.
And this isn't actually the first time this specific issue has come up, is it?
No, that's right. You have to go back to July 2020. During President Trump's first term,
Right, yes.
he initiated a withdrawal from the WHO then, too. This was, right in the thick of the early COVID-19 pandemic.
Right, and the reasons cited back then.
Well, a key one was criticism of how the WHO handled the outbreak,
Mm-hmm.
plus the assertion that the virus came from a Wuhan lab, and this feeling that the WHO hadn't properly addressed that possibility.
And that move caused quite a stir, didn't it? A lot of debate.
To put it mildly, yes. But it wasn't finalized because, fast forward to January 2021.
President Biden came in and reversed that decision. It was one of his first actions.
Exactly. So this new order, 4500155, it represents a second go at withdrawal under President Trump.
Okay, so the order itself, it must lay out the reasons for this withdrawal attempt.
It does. It gives a list. First up is, again, the WHO's alleged mishandling of the COVID-19 pandemic.
So those concerns from 2020,
Yeah.
they clearly persisted.
It seems so. It points to a fundamental disagreement, really, on how the WHO managed that global crisis.
Which is understandable. I mean, coordinating a global response with so many different countries, different health systems, it's incredibly complex. You can see how disagreements would arise.
Absolutely. The second reason given is the WHO's failure, as the order puts it, to adopt urgently needed reforms.
Reforms. Does it say what kind of reforms?
It doesn't specify exactly which reforms, but it signals a belief that the WHO needed significant changes. Operationally or structurally, that just didn't happen.
Okay, so it suggests a desire for the WHO to function differently. And you can imagine getting a large international body with, nearly 200 member states, getting them all to agree on big reforms is, well, tough.
Very tough. The third point raises concerns about the WHO's independence.
Independence from what?
From what the order calls inappropriate political influence of member states, specifically referencing back to 2020.
Ah, okay. That touches on that tricky balancing act for any global body, right? Trying to navigate all the different national interests of its members.
Exactly. How do you make decisions based purely on health and science when politics are always, in the background?
It's a constant challenge, I'd imagine. What else?
And finally, the money. The executive order cites the WHO's continued demand for unfairly onerous payments from the U.S.
Onerous payments, meaning the U.S. feels it's paying too much.
That's the argument, that the U.S. contribution is disproportionately high compared to other countries.
Does it give an example?
It does. It compares the U.S. contribution to China's. It notes China has a much larger population, but according to the order, its assessed contribution is significantly less, like nearly 90% less.
Wow, okay. That kind of disparity, well, it definitely fuels the debate about fair burden sharing, doesn't it?
It does. It frames the U.S. share as being out of whack. So those are the main justifications given in the text.
Okay, so what does the order actually do? What actions does it mandate?
Right, the key provisions. First, it formally revokes that January 2021 letter from the Biden administration that had stopped the previous withdrawal.
So it's reversing the reversal.
Pretty much, yeah. Like you said, policy whiplash on this.
Definitely feels that way. What else?
It also revokes another order, Executive Order 13987. Remind us what that one was about.
13987. That was President Biden's order. It was all about mobilizing the U.S. government for a coordinated COVID response and, importantly, asserting U.S. leadership in global health security.
So revoking that signals a pretty big shift in how the U.S. plans to tackle these global health issues.
A very significant shift, yeah.
Mm.
Away from that previous framework.
Looking forward, the new order tells the Assistant to the President for National Security Affairs to set up new structures.
Within the National Security Council.
Yes, specifically for handling public health and biosecurity, it suggests centralizing these things more within the White House.
Mm. Bringing it under closer presidential control, maybe?
Mm.
Instead of relying so much on international groups like WHO.
That seems to be the implication.
Yet to wonder, does that make things faster, more decisive?
Mm.
Or maybe more isolated, a bit siloed from the global picture?
That's the key question, isn't it? The order also gives specific jobs to the Secretary of State and the Director of the Office of Management and Budget, the OMB.
Okay, what are they tasked with?
First, immediately pause all future transfers of funds, support, resources. Basically, turn off the tap from the U.S. to the WHO.
Wow. That's immediate.
Yep.
And that's got to hurt the WHO's budget instantly. Funding is crucial.
Absolutely. A major cut like that will force changes. They're also told to recall and reassign U.S. government personnel or contractors who are currently working with the WHO.
So pulling people out, too. A formal distancing.
Yes, severing those direct operational ties.
Which could affect cooperation, information flow.
Yeah.
And where do those experts get reassigned? That's another question.
A good one. Furthermore, state and OMB need to identify alternatives.
Alternatives to the WHO.
Yeah, alternative U.S. and international partners to do the work the U.S. used to support through the WHO.
So the idea is to find replacements, to reroute those efforts.
That's what it implies. It suggests a belief that other channels can handle these functions effectively.
You have to look at the global health landscape. Are there readily available, equally effective alternatives for everything the WHO does? It's a pretty diverse portfolio they have.
It is indeed. Another big piece involves the director of the White House Office of Pandemic Preparedness and Response Policy.
What's their role in this?
They're tasked with reviewing, rescinding, and replacing the 2024 U.S. Global Health Security Strategy.
Okay, so it's not just about the WHO relationship. It's about redoing the entire U.S. strategy for global health security.
That's right. It's a much broader strategic shift being signaled here.
Quite comprehensive.
Then the Secretary of State has to officially notify the UN Secretary General and the WHO leadership. Tell them the U.S. is withdrawing.
Making it official. Setting the withdrawal process in motion, a big diplomatic step.
Huge. And finally, the order tells the Secretary of State to stop negotiations on two key things.
Which are?
The WHO Pandemic Agreement and any amendments to the International Health Regulations, the IHR.
Ah, those ongoing talks about future pandemic rules.
Exactly.
Yeah.
The order says the U.S. is pulling out of those negotiations and that any future actions to finalize them won't bind the United States.
So, stepping back completely from those multilateral efforts under the WHO umbrella, for context, the Pandemic Agreement is trying to set up that future framework, and the IHR are the existing legally binding rules for disease spread.
Right. So this is a clear move away from shaping those global rules through the WHO. It suggests maybe a more unilateral path.
It certainly points that way.
Okay.
So this is a massive decision. What were the immediate reactions? How did the world respond?
Well, the WHO itself put out a statement. They expressed regret.
Understandable.
They emphasized, their critical role, their long history with the U.S. partner since 1948, and they urged the U.S. to reconsider.
Highlighting past successes, too, I bet, like smallpox.
Exactly. They mentioned smallpox eradication, the ongoing polio fight examples of what collaboration achieved.
So a concerned response, but also reminding everyone of the value of that partnership. And the potential loss, not just of funds, but U.S. expertise.
Definitely. And then Politico reported on an internal email from the WHO Director General, Dr. Tedros.
What did that say?
It outlined immediate significant budget cuts, things like a hiring freeze, slashing travel budgets, moving almost everything to virtual meetings.
Wow.
And limiting even essential technical support missions to countries.
Those are very real, very concrete impacts. It shows an organization scrambling to cope with a sudden drop in resources that affects their work on the ground immediately.
No doubt. Doctors Without Borders, Médecins Sans Frontières, they also weighed in, critically.
What was their concern?
They warn about life-threatening consequences, especially for humanitarian work and global health coordination. Their CEO stressed how vital U.S. support for WHO-led initiatives is, particularly for vulnerable populations, disease outbreaks.
So they're pointing to the human cost. The impact on people who rely on these programs in crises. It really highlights how interconnected global health is.
It does. Then you had the O'Neill Institute for National and Global Health Law at Georgetown University.
What was their take?
They also expressed concern, called it a setback for global health governance. They pointed to the U.S.'s historically large financial role and reaffirmed their own commitment to international collaboration.
So focusing on the bigger picture, the structure of global health, U.S. leadership, or lack thereof.
Right. And interestingly, the Chinese Ministry of Foreign Affairs made a statement too.
Oh, what did they say?
They said the WHO's role should be strengthened, not weakened. And they affirmed China's support for the WHO and for multilateralism in public health.
That highlights the different global views on the WHO's value and maybe hints at shifting influence within the organization.
Potentially. And just for the record, the formal details. The order was published in the Federal Register on January 29th, 2025. Document number 2025-01957.
And that publication also officially noted the revocation of that earlier Biden order, 13987, just tying up the legal ends.
Exactly. So to kind of bring it all together, Executive Order 14155 is this major policy move, the U.S. withdrawing from the WHO.
And the reasons cited focus on those concerns about the pandemic handling, lack of reform, independence, and the financial contributions.
Right. And it's already stirred up a lot of reaction. Regret and concern from the WHO and health groups, support for the WHO from other nations like China.
The long-term effects, well, they're bound to be significant. For global health governance, for pandemic preparedness, for how the U.S. engages with the world on health issues.
Definitely. Which leads to a final thought for you, our listener. Considering everything we've unpacked, the reasons given for withdrawal, the immediate reactions, what do you see as the most critical, potential long-term consequences?
Yeah, consequences of the U.S. leaving the WHO, both for the U.S. itself and for the wider world. It's complex, lots of angles to consider, and it's something that will likely play out for a long time to come.